Warning, don't call an implant dentist until you hear this free message.
Pinecrest Dental, and you're here because you have some questions about sedation dentistry and you're wondering how that works and which option's right for you, or maybe you just plain hate going to the dentist, or you're terrified of needles, or like thousands of people, you're just terrified of the idea of having someone work in your mouth or a drill in your mouth. And we get it. We've helped so many people with feeling great about getting their dental work done. And we've seen so many people come in that are just terrified and help them overcome that. That's a lot of fun for us. So the options you have now are better than ever, safer than ever, and more effective than ever. So you kind of have three kind of main areas that you look at for sedation dentistry. And the first one is one that's been around a long, long time. It's tried and true, works well. It's the easiest, safest, most cost-effective, and that's laughing gas. And what laughing gas is it's oxygen mixed with another ingredient, and it's a very, very light sedation. It also tends to help the numbing work better. So if you're someone who you don't get numb really well, but maybe you're not that scared of the dentist, you just hate the fact that you get a whole bunch of injections and you can still feel the dental work. Laughing gas has been shown to enhance the numbing and make it work better. So the biggest downside to laughing gas is if you're having major dental work done, it's usually not enough sedation to help you feel really relaxed. So maybe if your nervous level on a scale of 1 to 10 is a 2 or 3 or 4, laughing gas is a great option. As I mentioned, it will also help the numbing work better. The biggest plus side to it, as far as being cost effective, is also that you can drive home afterward. The really neat thing about laughing gas is within 2 or 3 minutes of it being turned off, it's completely out of your system and mentally you're back to normal. Your second kind of sedation is oral sedation. This is the one we do the most of, and these are some pills we give you that make you very, very tired or sleepy. It's kind of similar, the example we give of someone being intoxicated from alcohol. And when someone's intoxicated, they get very sleepy on their own. Worries, pain, those kind of things are kind of forgotten. And for the most part, you'll probably doze off on your own. We do it all the time, and we notice people actually fall asleep or start snoring, or you can just tell they're really relaxed and have a nice nap. It's very safe because you're not being put out per se. You're actually doing it on your own because you're so tired and relaxed. You do need a designated driver to take you home because for about 4 to 8 hours afterwards, you can't drive or operate heavy machinery or those kind of things. It's best if you have someone you know take you home. We don't typically like you to leave in an Uber or a taxi because you don't know that person and you're essentially under the influence, and you should be safe. Think about those kind of things. So discuss those options when you're having treatment. If your nervousness level is a 5, 6, 7, 8, something in that range, oral sedation works incredibly well. It also works as a muscle relaxer, which is nice because then when you're having a bunch of work done, your jaw's not so tired because it helps relax those muscles. If you have a small mouth, a gag reflex, those kind of things, oral sedation works incredibly well. We use it routinely if you're coming in for implants, you're coming in to have bridges done or full mouth implants or teeth removed, and you just want to tune it out. With oral sedation, usually you'll forget 50 to 100% of what happened after too. So similar to when someone's intoxicated, is the short-term memory loss is exaggerated, and that's kind of nice because then you don't have to remember the dentist or think about it. The third kind is IV sedation, and that's usually where an anesthesiologist or an oral surgeon will use an IV to induce sedation really fast on you. So think of it as similar to the same medications you would use orally, but they're done through an IV, so it goes really fast. There's a little more medical history involved, a little more time involved, a little more recovery involved, more cost involved. But it works really well if you're a 10 out of 10 or a 9 out of 10 where you just hardly can step in a dental office without your skin crawling or the idea of a procedure, then this is a really great option for you. And so, when you're discussing your treatment and you're looking into options, and maybe you're looking for a new smile or veneers or implants, or you have some broken teeth that need to be removed and you're terrified, sedation works really well. So discuss this option with the trained team that does a lot of this. And, if you're in an office where you're not being offered that, then give us a call or give a trained sedation dentist a call. We, get people all the time. I had a friend just the other day who came to see us because his old dentist didn't offer it, and he hates dental work. He's scared, he's terrified, and with the sedation, he gets relaxed and more comfortable. So if you have some more questions, please check out our next video. We're going to discuss more on some of your newer options for dentistry, and you can click on our channel below for other videos like this. So thanks for watching, and we'll see you on the next one. Have a great day.